Hi, my name is Dr. Marwan Sheikh. I'm a reproductive endocrinologist, fertility specialist here in Jacksonville, Florida. I decided to talk today about the cost of IVF. The reason I thought of this is because I recently had a daughter of one of my friends who lives in Miami, and she called me to let me know that her IVF in Miami is going to cost her about $16,000 to $17,000 without the medication, which is, of course, an exuberant amount of money. She's a doctor, she can afford it, but most patients won't be able to afford that. So I'm going to talk about the financial burdens for IVF. And the way I like to talk about it is by dividing the cost between the cost of in vitro fertilization itself and the cost of drugs. These are the main costs. So the in vitro fertilization process involves the lab where the eggs are cultured and grown. And it involves the monitoring of the patient, which involves blood testing and ultrasound. As far as trying to reduce the cost of in vitro fertilization itself, there are options for patients. For example, one of the options is something called InvoCell. In other words, instead of taking the eggs, fertilizing them in the lab and watching them grow in the lab and transferring them back into the uterus in 3 to 5 days, we can put the sperm and the egg in this little gadget called InvoCell, insert it in the vagina, and then 5 days later take it out and see how many eggs fertilized and put one fertilized egg back. This is less expensive than regular in vitro fertilization. It seems from most of the data that the chance of pregnancy is slightly less than regular in vitro fertilization, but you save with the cost. InvoCell in our program costs $5,000 as opposed to in vitro, which is about $8,000. Other ways people have tried to decrease the cost of in vitro fertilization would be to use minimal stimulation, use less drugs. Now, recently, most of the medical literature is suggesting that in the older patient, using less drugs is just as effective as using a lot of drugs. Or in patients who are low responders, that patients who don't produce lots of eggs, by giving more medication, you are increasing the cost, but you're not increasing the chance of pregnancy. So in this category of patients, using less medication may help with the chance of pregnancy and decrease the cost of in vitro. One of the things that I see all the time in patients, they say, I want to put more than one embryo back. I want to put 2. Because I want to get pregnant and get it over with. The fact of the matter, the bottom line, if you put 2, you increase the likelihood of multiple pregnancy. And multiple pregnancy has a lot of problems. We see the cute twins in the mall, walking in the mall, but these are the ones that everybody sees in the mall. You don't see the problems that we see in the hospital. On the average, transferring 2 embryos actually increases the cost of IVF by about 33%. So it's always better to put 1 embryo at a time. Now, one of the ways we try to decrease the cost of in vitro fertilization is by decreasing the cost of travel. Sometimes you get patients all the way from Miami or Tampa. We try to have them do all their work, ultrasounds, blood tests, where they live, and they don't have to travel back and forth. They only travel when they need their egg retrieval and when they need to put the eggs back. That decreases the travel cost for these patients. Now, as far as the lab part of in vitro fertilization, unfortunately, the cost kept going up and up and up. But there are certain things that we can do to decrease the cost of the lab. For example, the procedure which is called ICSI, intracytoplasmic sperm injection, was initially designed for males who have low sperm count. But more and more programs are using it in patients just to fertilize the eggs. There is absolutely no proof that doing ICSI on a normal, healthy-looking egg is going to increase the chance of pregnancy, but it increases the cost of in vitro fertilization for no reason. Another issue is prenatal genetic testing. Patients come and ask, well, I want to make sure that my embryos are tested, that they are normal before we put them back. If you are younger than 35, there is no evidence that doing prenatal genetic testing improves the chance of pregnancy or makes any difference. It just increases the cost of the treatment. I have to admit there are certain situations in the younger patient where pre-GT, prenatal genetic testing may be helpful, but most of the time, if it is not a male-related factor in the younger patient, you don't need to do ICSI for an egg factor. Another thing that we're trying now to use is less monitoring, especially in the patients who live far and they have to pay for the ultrasound. And that would be to do simplified monitoring. Instead of doing 3, 4, 5 ultrasounds, we can limit it to only basically 2 ultrasounds. One ultrasound is around day 2 or 3 of stimulation, of starting the drugs, and one around day 8. And in general, 90% of the time, that is more than enough for me to make a decision to go with the egg retrieval or not, and that decreases a lot of the cost of monitoring. Blood testing also, we don't really need to do a lot of blood tests throughout the stimulation, throughout the injections. We can limit that basically to one test around day 8 of the treatment cycle, or right before we get the eggs out. And that will help me know if this patient is going to hyperstimulate, have problems, or if her progesterone is going high, so we have to freeze her embryo. I can get all that information from that one blood test on day 8 or 9, right before the procedure, the egg retrieval. One other issue relating to the drugs and the cost of the drugs, we mentioned that minimal stimulation, giving less medication, may be just as effective, especially in the older patients and the patients who have decreased ovarian reserve. We can also decrease the cost of the drugs by using a combination of fertility pills and the injectables. Quite frankly, this is reported in the literature. I have not tried it. I am not fully convinced that this will work as well as just giving the injections, but this is an option. Another thing that may decrease the cost is one of the medication we use is called ganirelix or citrotide. These are medications that are extremely expensive, and they're used to prevent the patient from ovulating too early. We can give these patients a relatively very inexpensive drug called Provera, which will definitely prevent them from ovulating too early. The only drawback of that, when we give Depo-Provera pills, we cannot transfer the embryos fresh. We have to freeze all the embryos and transfer them later, but it would be worth it, believe me, because the cost of this medication is extremely high. And one final thing I want to talk about, the in vitro fertilization cost. I mentioned in Miami $16,000, $17,000 for an IVF cycle. We offer patients here who, especially low responders, to pay for 2 cycles, and this will cover 3 cycles of IVF. So instead of paying $8,000, paying $16,000, and believe it or not, this will cover 3 cycles of treatment, and that will give them a much better odds at achieving a pregnancy, especially if they only produce 1, 2, 3, 4 eggs, and they may end up with 1 embryo a cycle. This will give them a much better chance of it. As far as financing, we have a list on our website of financing companies that will finance in vitro fertilization. One last thing, I know I just said one last thing, but this is another thing I want to talk about. Patients who've had their tubes tied and they want them untied. The bottom line, do we do in vitro fertilization, which is more expensive than untying the tubes, or we untie the tubes? Which is better? If you are younger than 35, tubal reversal will give you a much better and less costly chance of pregnancy. Once you get to 37 and over, IVF will be a much better choice, even though it may be a little bit more expensive. I will stop at that and see if I have any messages regarding this presentation.
Let's see who's joined. Liz 575 wants to know how much. How much for IVF, Liz?
Okay, Liz, the IVF, as I mentioned, IVF here is actually $7,950 for the cycle, but that doesn't include the medication. Invocel, if you are young, less than 35 years old, would be just as good, and the cost is only $5,000. So the other thing I failed to mention is that we go by income also. For example, if your income is less than $100,000 a year, you get a 5% discount on these charges. If your income is less than $75,000, you get 10% discount, and if it's less than $50,000, you get 15% discount on your IVF cost. Okay.
All right, anybody else? Save IVF joined. Hello, Save IVF. Who else? Janie Grubb, thanks for joining our live.
Okay. I think it is safe to stop here, I believe.
Okay.
Okay. Thank you very much for listening.